So first of all, welcome. Bienvenue à tous to Hand Up Congo's webinar today on Goma, Care in the Midst of Conflict. My name is Vera Sistenich. I'm a doctor and specialist in emergency medicine based in Sydney, Australia. I'm also the team leader of Hand Up Congo's Building a Healthy Congo project. Thank you all for caring about what's happening in the DRC and taking time in your busy lives to be together here tonight. I would first like to thank all the Hand Up Congo volunteers who have made this event possible. Firstly, our fearless captain and co-founder, Mama Lucy Hobgood-Brown. Also Matt, Rick, Fergus, Kieran, and Maureen for all of your technical and logistical support. A bit of housekeeping. Please kindly mute yourself to improve the audio for everybody here. We encourage you to put your questions in the chat box. We will do our best to answer as many of your questions as possible and to have an interactive session towards the end of our hour together. This webinar is being recorded. If you know people who can't join us live tonight, please tell them about this event, and we will put a link on the Hand Up Congo website under the News tab. You just need to go to www.handupcongo.org. Today, we are delighted and privileged to have three presenters who are deeply knowledgeable about life and delivery of medical care in the Democratic Republic of Congo. First, we will hear from Ambassador Matthew Neuhaus, who was Australia's first ambassador to the DRC. He will briefly set the scene for us. Rebels have taken eastern cities of Goma and Bukavu. Why does this matter, and what could happen next? Then we will hear from Dr Muller Mundenga, Medical Director of Heal Africa Hospital in Goma, and only one of a handful of specialist emergency physicians based in the Congo. Due to Dr Muller's heavy patient workload during this time of crisis and the uncertainty of internet connectivity, we decided to play it safe, and a few days ago I recorded a conversation with him, which we will play for you later. Our final guest will be Dr. Neil Wetzig, who is an Australian general surgeon and consultant and advisor of surgical training programs at Heal Africa Hospital in Goma. In November 2024, Dr. Wetzig was elected president of the Permanent Council for the G4 Alliance, which is a global association working towards safer surgery and anesthesia across the world. I would also like to acknowledge Dr. Julu Kabongo, if he's here with us, current president of the Emergency Medicine Association of the DRC. At the conclusion of the presentations, we will address your questions, so please don't forget them to put them in the chat box. We will then have closing comments from Ambassador Neuhaus and Dr. Wetzig. We're also hopeful that Dr. Muller will be able to join us. So firstly, Ambassador, we feel honored to have you here this evening. Are you able to start by giving us a historical and political overview of what has led to the conflict in Eastern Congo in recent weeks, please?
Well, thank you very much for that welcome here today. And can I congratulate Lucy and Hand Up Congo for hosting this webinar and bringing this issue really to both the minds and the hearts of Australians. I have to say, it is now quite some years since I was ambassador. And of course, I speak in a private capacity. I'm now a retired honorary professor at the Australian National University. But I have continued to follow closely what has happened in the Eastern DRC, particularly since that period, 10 years or so ago, when Australia, were on the UN Security Council, and I did visit the region. Now, there is a very simple narrative, and there's some truth to this narrative, that the M23, who've been there for quite a long time, have taken advantage of this current situation and are being supported by Rwanda next door. And Rwanda, as has been called for by a UN Security Council resolution on the weekend, needs to stop its support for the M23, and negotiations need to begin again with the DRC government. And that is a fact that needs to happen. The M23 too is quite a nasty movement. It's been guilty of war crimes. In fact, one of its former commanders, Bosco Ntaganda, ended up after the last period of conflict 10 years ago in the International Criminal Court, because my most recent ambassadorship was in The Hague working with the International Criminal Court. But there is a history here, and it's a history I'm aware of because I grew up as a missionary child in Tanzania on the border with Rwanda at one time in the 60s. And it is a history that is driven by different ethnic groups, in particular the Tutsi and Banyamulenge, who are their kin, and the Congolese, and the borders that are there, and the need for there to be a better recognition of some of those issues. In 2013, I had the privilege of going to Goma and actually visiting the Heal Hospital, and I was so impressed by the work that was being done in the midst of conflict. And at that time, I'm pleased to say that the Security Council was able to act. MONUSCO, the UN force, was strengthened. Pressure was put on Rwanda that did pull back, and the M23 was, at least for a period, brought to book. But it became clear to me as I went out into the surrounding refugee camps that life was not as simple as that. Luckily for me, I speak some Swahili and from my childhood. And when we landed in one of these refugee camps, there was quite an outspoken woman who, when she learned I could speak Swahili, was prepared to really talk to me in a very frank way. And she said to me, I said, daughters to get water without being raped. And I said, thinking it might be the M23 that were guilty, who's raping you? She said, these very soldiers who are now guarding you, DRC soldiers. On the way back, our helicopter flew over a town, quite a substantial town, which had been destroyed. And I asked some people what had happened there. And they said, well, this governor, who's a very impressive man, well-educated, it wasn't to his interest for there to be peace with the M23. So when the M23 had gathered there to have some peace discussions, he had the town mortared. And then, of course, they fled and the peace fell apart because it was in his economic interests for this to happen. So all I say there is that it is a very complex story. We do have now in that part of the world, Rwanda as a very effective African country, highly developed, and now a member of the Congo and of the Commonwealth. And I was involved in the past, now 20 years ago, in negotiations with President Kagame for them to join the Commonwealth. And Kagame at that time said to me, when I asked him, why do you want to join the Commonwealth? He said, well, we need a bigger Rwanda. And he said, I don't mean by that territorial aggrandizement, but we do need to be part of the East African community. We need to be part of the Commonwealth. We need to be a part of a wider world. So we do not once again engage in a genocide on one another. And I think this is part of the issue. There is a real need in this part of the Eastern Congo where the writ of the Congolese government is not strong, where unfortunately the international community, which is getting weaker and weaker and less resources being provided to forces like MONUSCO, for there to be a settlement that does something for the whole of the neighborhood, for Rwanda, Uganda, and DRC. And this, of course, is why the East African community and SADC have now got quite involved, including putting troops on the ground. For those who think that situation is absolutely hopeless, another part of the Congo I've worked with a lot over the years has been Katanga, where in fact in the southeast, near Zambia, where once again it was once a separatist province, and it has great mineral wealth. But over the years, it has found a better way for accommodation between Kinshasa and Katanga. We need to find such a settlement in the Eastern DRC. And we need for the DRC government also to be very serious about negotiating with the neighboring countries and with all the various groups so that they have a stake in the future of this part of the DRC that benefits all its peoples. I'm sure there'll be many more people on this who will be able to talk better of the more recent situation and understand the complexities even more than I do. So this is just an opening gambit. But can I say the humanitarian issue is tremendous. Many people are suffering, millions are suffering, thousands are being killed. And I do admire those who are trying to bring humanitarian support in the midst of this.
So, Ambassador, I think we've lost Matthew just briefly. There we are. He's back. Ambassador, it is said that to summarize the conflict in Eastern Congo as primarily over precious resources is perhaps an oversimplification. And you've alluded to the complexity of the history of the current situation. So in your view, is there significant local Congolese support from the M23 movement? What is the dynamic between the local government or army and the M23 movement? This is often quite confusing and quite opaque in the international media.
Well, I think it even remains confusing and opaque to people like myself. But yes, there is some support, particularly amongst the Banyamulenge, who are of a Tutsi ethnic group. There is fear still from the days of the Rwanda genocide of people of the Hutu ethnic group in this part of the world and the conflict there. I think certainly there has been activity by the DRC soldiers in the past that hasn't helped. That said, the M23 is a seriously nasty group. They've been guilty of using child soldiers, of war crimes, and interestingly, Karim Khan, the prosecutor of the International Criminal Court, has arrived in DRC at present to look more into this.
Mm-hmm. And so what do you think is their ultimate stated or covert goal of the M23? If they had things go their way, what do you think they're actually after?
Well, I think the membership of the M23 is broad. There's the military wing, which is particularly bad. There's a political wing. But I think the people that they represent do need to be more included in the future, both political and economic future, and have a better say in the political and economic future of the Eastern DRC. The capital, Kinshasa, needs to work with the people who are on the ground far more.
Mm-hmm. So now Goma has fallen to the M23. So what does this mean in terms of everyday life? So in practical terms, what does it mean for a city to be under rebel control? Does it now mean that they'll be running the schools, the public services? How does life change and what does that mean?
Well, I think Neil Wetzig, who's been there, might comment better on that later. But simply to say, at this point, I don't think the M23 is capable of the sort of governance that you are talking about. Next door in Rwanda, Rwanda is a very efficient country. It knows how to do that. But I don't think any of us want to encourage Rwanda to actually run things in the Eastern DRC. That would be a step too far. But Rwanda, if it was put into a more positive space, could assist the DRC with better administration in the region. But as I have discovered myself in the past, there are many forces there who benefit from the chaos economically and really don't want that to happen.
Mm-hmm. So how do you see the current situation unfolding? In your view, do you think it's likely to subside, intensify, or could it even catalyze regime change?
Well, in the short term, it will probably intensify. And this is where the regional countries from the East African Community and SADC will have to play more of a role to bring particularly the DRC and Rwanda back to the negotiating table. The DRC has refused, so far as I understand it, to actually negotiate with M23. But I think the political wing of the M23 will have to be part of the negotiations for a more sustained peace in the region. Sadly, the UN Security Council is particularly weak at the moment. We see, unfortunately, permanent members like Russia and even, it seems at the moment, possibly the USA, taking steps under international law in other countries which are not encouraging. Both France and the UK, though, have quite a lot of influence in this part of the world. UK has a close relationship with the Rwandan government, and I've been pleased to see the British Foreign Secretary coming out quite strongly recently, and I think they can also play a useful role into the future.
Mm-hmm. So what can the international community do, particularly in light of the shifting global forces currently, to help resolve this humanitarian crisis?
Well, I think the international community does have to step up to the humanitarian crisis, and that includes the USA, which incredibly looks like it is trying to destroy its own US aid organization, which has played a very important role in Africa and in situations like this. This cannot be allowed to happen. It's terrible for the world for something like that to happen. But the whole of the international community will need to step up. And I am encouraged by the fact that there was a unanimous UN Security Council resolution on the weekend, and that needs to be implemented, and that may help. But we must be alert, while there are so many other crises around the world, to this particular humanitarian crisis in the region. And the countries around, including Rwanda, need to give access for humanitarian assistance. I have to say, you get to Goma largely through Rwanda. It's very close. The Rwandan border is very close to Goma. So Rwanda does remain essential to that provision of humanitarian assistance.
Thank you very much, Ambassador, for painting that backdrop for us. I would now like to turn to the interview that I conducted with Dr. Muller at Heal Africa in Goma a few days ago. Through Hand Up Congo, I have known and worked with Dr. Muller for the past 10 years in promoting emergency medicine training and development in the DRC. Dr. Muller currently, amongst many other duties, delivers a 3-month course in emergency medicine at Heal Africa to upskill nurses and doctors from all over the country. He repeats this particular course 4 times throughout the year. Dr. Muller and his team have been treating victims of the current conflict in Goma and shares with us some of his recent experiences. This interview goes on for about 10 minutes, and I would like to thank our volunteer Fergus for editing it for us. Dr. Muller, thank you so much for being with us on this webinar, Care in the Midst of Conflict. We are so grateful that you can join us, and we understand that these must be uncertain, frightening and stressful times for you. So first of all, how are you?
Thank you, Dr. Vera, for organizing this interview. So far, the life is coming slowly, because as you know, this is the war, the situation never experienced before, such a big impact. In 2012, we had again the war, M23 war, but this has a very big impact. But we are trying to do what we can to save life.
And so, Dr. Muller, you're one of our closest emergency medicine collaborators in Hand Up Congo. And we and the team, we've been to visit you in Goma, and we know Goma during peaceful times and how wonderful the Heal Africa hospital is and the emergency department that you are building. So can you share with us, at the beginning of the recent M23 conflict, how much warning did you get that you might be faced with a mass casualty scenario?
Yeah, Dr. Vera, at the beginning of this war, we didn't expect to have such a big impact, and we didn't expect that the rebels will enter Goma, because this recent war started around 3 years ago, and they weren't able to enter Goma. And then it was suddenly, we didn't have enough time to prepare ourselves.
So once you recognized that it was going to be sustained and very serious, did you ever sort of stop your colleagues or have a moment where you explicitly discussed what you thought was going on? Or was it that once the ball started rolling, you just had to deal with whatever was coming through the door?
No. So I had I met with my colleagues, with the nurses, 3 days before the war. Yes. And it was to say we need to prepare ourselves. We don't know what will happen. I think we made a plan for the specialist supervision at the hospital, the plan with the nurses and the medication, but it wasn't enough.
And did any of your colleagues choose to leave the hospital in order to, what would have been very understandably, look after their families or to flee the city? Did anyone leave, and did you have a workforce shortage?
Yes, the war started, it was in the evening, Sunday evening, and it's only myself, I was there in Sunday evening. We couldn't go out to take care of our families or to bring more people to come to help us until 4 days. We were in the hospital with the same team. Oh. But when we tried to go out to send our 2 ambulances to bring patients and more people to help us, then our ambulances were shorted, and one of the driver received again a bullet in the pelvis.
Oh gosh! And did that driver survive?
Yeah, he survived, and so we did have shortage because all surgeons were not able to come in the hospital at that moment because gunshot everywhere, the bombs.
So what were the signals that you could change shift or change staffing?
The plan was to wait until the gunshots and the bomb will stop. And after 3 days, we tried to go to bring more people and to bring patients, and that is the time our ambulance was sorted. But at the 4th day, it was quite calm, and is when we were able to send more people back home and to bring others and to go to collect some patients.
So can you give us a sense of the types of injuries that you dealt with during the conflict and the sort of numbers of patients that you treated in your ED each day?
Well, the trauma, it was more trauma, gunshot trauma, the bombs fall, and many patients sustained chest trauma, abdominal trauma, fractures, and head trauma.
And so I understand, Muller, that in the Congo, most medical treatment is paid with out-of-pocket costs. So how is the department and, Heal Africa managing this?
Yeah, so it's very, very difficult. We received, in the 4 days from the start of the war, around more than 600 patients. And it was a Sunday. All the banks that are not working, so we are taking care of all patients for free. Yes. And after when it was a little bit calm, then we started to see people from NGOs to come to see what is going on and to help as much as possible with medication, with food. That's because we weren't able to give food to all the patients.
And on that note of provisions, we heard that in Goma, many civilians took refuge in the grounds of hospitals. Did this also happen at Heal Africa? And if so, how were the hospital systems able to cope with additional people just taking refuge in your grounds?
Yeah, it wasn't easy. We received many civilians who thought that being at the hospital, it's much safer for them. Yes. And some did lost their houses from the bombs. So it wasn't easy. The security of the hospital helped us a lot. And then as soon as it was a little bit calm, we were encouraging them to go back in their families, as we couldn't be able to take care of and to give food and manage all the crowds of people.
And so with a little bit of hindsight now, what do you think that your ED did well during the conflict, and what aspects of care delivery do you think is most in need of further development?
Yeah, I think what I can say, I'm very, very proud of the ED team. We couldn't ourselves take care of all those patients, so we were able to collect more nurses, more doctors who didn't go back home, and then there wasn't the way to go home because of the fighting. So we gave priority in the very sick patients, and I think the 3 month course in emergency medicine that we are developing at Heal Africa helped a lot, because most of the ED team benefited from that course. So they know the triage system, they know what can be the priority, able to go through the first survey, and that helped us a lot.
Yes, I think it's incredibly important work, Dr. Muller, that you've been doing, and so timely. Thank goodness you are there with your expertise and training, and have trained those around you for this time of conflict. So finally, is there anything else that you would like to share with us regarding your recent experiences?
Yeah, thank you very much, Dr. Vera. Yeah, so I think the training is very important in emergency medicine, and training more people, nurses, doctors, helped us to sustain and to take care of very crowded people during the war. So I would like to seek for advocacy for each organization, any organization that will help to make this 3 month course sustainable, more sustainable. The way to help is to spread the knowledge. Thank you.
Dr. Muller, thank you so much. You are very precious to Hand Up Congo and to Goma, and we thank you very sincerely for everything that you're doing. And please stay safe, you and your team. And thanks again for being with us.
It's for me to thank you, Dr. Vera. Thank you.
Thank you, Matt, for getting that going for us. That's great, and we are so grateful to Dr. Muller. Before we move on to our final guest, I just want to read a short extract from a message that Hand Up Congo received a couple of weeks ago from one of Dr. Muller's trainees. It says, "I am Dr. Kamangu Kabiona Emile." Dr. Emile, you might be here, so hello and welcome if you are. One of the doctors who had benefited from the 3 month training in clinical emergency medicine at Heal Africa Hospital through the Hand Up Congo Association. All aspects of this training have enabled me to deal with ballistic wound emergencies of all kinds. We also see some arriving lifeless, but nevertheless, we are practicing everything we learned in emergency clinical care to save many human lives. So that's just reflective of the important work that Dr. Muller is doing with his team regarding emergency care in the Congo. And now to our final guest, Dr. Neil Wetzig. Can you describe to us what the Heal Africa Hospital is like, its mission, services, and its context in the city of Goma?
Sure, Vera, thanks for the question. And I just want to say that listening to Muller, I know a fair bit of that story, but he is just such a star, and he's doing his best to treat his own people in Congo. So Heal Africa Hospital is a 350-bed hospital. It's in the close centre of the town. and it's the largest of about 7 major hospitals. There's a lot of small health centres that call themselves hospitals, but it's the largest of about 7. It's well equipped. Its mission is to provide holistic care. That is Dr. Joe Lucy, the founder of Heal Africa. His mission is that you deal with the physical, the emotional, the spiritual, and obviously the psychological. And it has a particular interest in sexual and gender-based violence. However, the training that has occurred, one of the great things about Heal Africa is that there is a major significance placed on training to create sustainable change. And that's what Muller's been doing in the emergency area, and I've been involved in training basically surgeons and also training rural doctors in basic surgery, because they do 7 years of medical training. They go to rural areas and they are not trained practically. So that is one of the key parts of Heal Africa. There is the hospital, which provides the clinical services. There's the Heal Africa Training Service, which provides the training, and Muller is part of that. And then there's a community health centre, and there's a community development program. So there are 4 key components to the organisation. It's a not-for-profit Congolese organisation.
Neil, just on the issue of surgical training, since you've touched on that, so from a surgical management point of view, war injuries are quite different from other forms of trauma surgery. So can you explain to us what, in layman terms, what are some of these differences, and are the local surgeons at Heal trained in war surgery?
The significant difference is there's potential for rapid blood loss, deterioration of the patient, widespread injuries, and also ballistic or gunshot wounds, bomb injuries can have wider spread. You might see the entry point where there's been an injury, but you have to look at where the exit point is, and all of the organs in between those two can be damaged. So that's part of the problem. Is it's quite different to having just basic elective surgery. Now, because of the conflict in the region, which has been intense over the last 2 to 3 years, we've been dealing with war injuries, fairly sporadic, not the level of mass casualties that have occurred in recent times. We did have a significant mass casualty in August last year. So I have been travelling to Congo since 2003 for a couple of weeks a year, training doctors over there at Heal Africa Hospital. But I finished my practice in 2015 in Brisbane, so my wife and I could spend longer, and we've been living in Goma and working at Heal Africa. I have the fancy title of consultant and advisor of surgical training. But because of that, we've been particularly upskilling the staff on war-type injuries. And I have to say, one of my great advisors in this is a distant relative of Matthew's, Susan Neuhaus, who's a military surgeon at ADF, and has given me a lot of advice about that, and Susan's a good friend. So you've got abdominal, chest injuries, pelvic injuries, but also a significant problem is head injuries. The modern fighting or warrior in our war zones have their heads well guarded by and most of their body guarded. But the Congolese army and the local fighters often do not wear helmets. You may have seen things on the TV with reports of the Rwandan troops being heavily armed and heavily they have helmets and things like that. But the local population often does not have it. So one of the big problems in recent times has been head injuries, gunshots and shrapnel to the head. So that's been a significant problem that we've been training our surgeons in for the last 2 years. We have this surgical training program we commenced in 2016. I'm pleased to say that we have 2 very fine young Congolese surgeons that have come through that. These guys are so good. These are my surgical sons, if I could put it that way, as is Muller. And they are so good, they would get jobs in Australia. I do not want them to leave, but we've been working with them. So they provide the surgical services along with one of the longest standing surgeons, Dr. Medard. The problem was that this attack occurred on the Sunday, as you heard Muller say. So they were actually not in the hospital. They live relatively nearby. One of the reasons the ambulances were shot up is that they were actually going to get the surgeons in the middle of the conflict. So these are some of the humanitarian violations that have occurred. Shooting up ambulances, you know, is not the right thing to do. They were going to get the surgeons. Now, they were not able to get to the hospital till 3 or 4 days after the conflict started. And so they've spent the last couple of weeks working extremely hard to mop up, if I could say, the casualties and deal with the surgery, the necessary surgery. So that gives you a little bit of the picture. And one thing I'll also refer to is, as Muller said, the banks were all closed. It's Sunday. Banks close Friday afternoon. There's no money in the system. There's no money to pay the staff. There's no money for people to get funds to buy food. So there's been significant issues about just the general population having issues with food supply for patients. They ran out of fuel for the generator. They were able to get some. Keeping all the equipment in the hospital running was a significant problem. Our charity AusHeal put who has funded the training of Muller, but also put an oxygen plant in 2018, and they needed the electricity to keep the oxygen plant going, because you need oxygen during those critical injuries, as you would know. And so keeping all that logistical thing going was difficult, because they just ran out of money and fuel. Now, thankfully, that has stabilized, but there is still significant problems in the area.
And perhaps I'll put to you what I put to the ambassador earlier regarding life under rebel influence or rebel control. In practical terms, what does that mean? So, who will end up paying for schools and roads and hospitals, and what do you think security is like in that sort of scenario?
Look, I'll give you a picture of this. The schools closed on the Friday. I think it might have been Thursday afternoon. Children were sent home from schools. The schools have been told by the M23 to reopen, but most parents are very fearful that they do not want to send their children out in this environment. So most of our friends are still keeping their children at home. That is a significant problem. The police have been disbanded, so the police control the traffic, and they also guard many of the places. So where we stay at Dr. Joe's house in Maji Matalivu, the policemen have all been disbanded, and it's now guarded by a security company, but they are unarmed. So there is a lot of fear in the community. Rightly or wrongly, we're not sure what happened, but a number of prisoners escaped from the local prison. Now, they were able to take up the arms that were dropped by the Congolese army, and they've been terrorizing the community as well. It's seemingly unchecked. Now, whether they were let out by the M23 or whether they just escaped, I think that's conjecture, but it is quite insecure. To give you two instances of the propaganda that's being rained by the M23 at the moment, in the week following the invasion, they ordered everybody to go to the local football stadium, which is near the centre of the town. They then filmed that and said, "Look at the Congolese population welcoming us." So this is part of the propaganda.
Yes.
Even over this past weekend, we have heard reports from our young friends there, but verified by Muller, so I'm in fairly close contact with them, that that the M23 have been going around the city, pulling up young people, youth, and telling them they have to join the cause, a bit like the child soldiers, etc. And if they say no or resist, they are shot and killed. Now, we've had, this is just like in the last 2 to 3 days. So
Gotcha.
we actually know of some very good quality young people who have been killed. So it's really quite distressing to hear that. There is, and one of the things, Goma traffic is terrible, not as bad as Kinshasa, but it's terrible. One of the things I saw them say is, look, we have fixed up the traffic problems because we are now controlling it much better than the Congolese do. The fact is
Yes.
that there are very few cars on the road because people do not want to go out.
Right. Yes.
The community is living in fear. One of my surgical colleagues had told me just on Sunday that 4 bandits were shot just outside his parents' home. So it's obviously quite distressing to the general population, but also to the medical staff who are trying to deal with the psychological trauma of all the terrible injuries they are seeing, but also protect
Yes.
families at the same time. So I'm just trying to give you a picture of some of the difficulties they're facing at the moment.
Yes, thank you. And you happened to be away from Goma when the recent fighting broke out. So do you think you'll return to Goma to continue work there? And if so, how will you judge when the time is right?
That's a very good question. We had a pre-planned trip to leave just before this happened. So we had left to come back to Brisbane. In some ways, that's good for us because we didn't have to decide whether to leave. And the Australian Embassy, I've got a good relationship with them and they've been in close contact. And they wanted us to get out if we had not already left. So the difficulty is, when do we go back? And again, there is a lot of anger in the Congolese community to the international community that does not appear to have supported them. And just one side story, there's a lady we know who's Canadian, who's Mzungu, white, married to a Congolese pastor that's been there for 30 years. And she's expressed some fear that she does not even want to go to the market because there has been some pushback against the international community from the local community who feel that they were deserted by them. So we have to take all that into account. We're taking advice from, we really regard the advice we get from Dr. Muller, who protects my wife and I,
Yes.
from Dr. Joe Lucy, the founder, Dr. Justin, the CEO. We have a friend of ours who's a media coordinator for UNICEF. He went into Goma on Sunday and he's giving us some pretty terrifying reports about what's been happening to children. And so we've asked him to give us some advice. And then we have the embassy as well. My gut feeling is we will not be able to go back for some months, which is somewhat distressing. We've had to cancel a lot of our training courses, as has Muller. We're toying with the fact of going back through Rwanda in perhaps late March, early April, to maybe just myself and one of our other colleagues to assess the situation. I'm not sure I want to put my wife in that situation. It's quite a difficult decision.
Yes.
And this side of the world, you feel somewhat helpless. So the best thing that we feel we can do is keep in touch with our Congolese colleagues, advocate on their behalf, and tell them that we have not deserted them just because we are able to get out. So that's a bit of an overview.
Well, thank you very much. I do hope peace returns so that you too can return to continue this the fabulous work that you are doing there. So we'll move now to some of your questions. I'm just scanning some of them. Thank you for posting them in the chat box. So I will pick this first one from Brian Gleason, and I think this is going to go to Ambassador Neuhaus. There has not been any mention of MONUSCO and the UN mission. I worked in UNDP in the mid-2000s and visited DRC Goma as part of a crisis response team. What is the current and future role of the UN mission in the DRC?
Well, I'm glad, Vera, you've raised that. I saw that in the chat from Brian, and I thought that was a very good question. Now, because Neil and I, in fact, were chatting about MONUSCO before he came on, and recalling when Neil rang me in the past from Goma and had to take a refuge in the MONUSCO compound. I think one of the issues here, and indeed why this crisis has come upon us, has been the weakening of MONUSCO in recent months, even years. the DRC government was keen to get it out originally. It's now accepted an extension of the mandate, but it is rather smaller as a body than when I was there. It does not have a peace enforcement mandate. At the time of the last crisis, it actually had to take on a peace enforcement mandate. Now, there is some local African troops from SADC and the East African community who are supposed to have such a mandate, but they really aren't. They don't have sufficient equipment. And I think this plays into Neil's point about this sense of being deserted by the international community. And we really do, what the Security Council does need to do in short term, and the DRC has to agree to it, as of course does Rwanda, but if enough pressure is put on Rwanda, it will have to agree, is MONUSCO has to be strengthened and the M23 has to be pushed back. I see no possibility of the M23 actually running anything like a reasonable administration. They are a very nasty guerrilla group. So there has to be that role played in a more assertive way by the international community. Just while I've got the floor, there's also a question about the diaspora engagement, and I do think the diaspora have a role to play as well, both Congolese and Rwandan and indeed Ugandan, and we might talk a little bit more about that.
Yes, thank you. I'm glad you touched on that. I think it's highly relevant in the world today, the influence of diaspora on the international politics and bringing troubles from origin countries to other ones. Now, I'd just like to pick out a question from Brian, who says, I'm a social worker and humanitarian. I would like to know, as I am in Bukavu and the social situation is critical, like everywhere in the east of the country, I would like to know if Hand Up Congo takes into account the psychosocial impact of the conflict in South Kivu and if it plans actions in this region too. So just on behalf of Hand Up Congo, Brian, thank you for that question. We don't specifically have a mental health program as such, but all of the work that we do, including the obstetric and emergency care, is against a backdrop with sensibilities for the context. And we do hope that we are effective in that regard. And we're constantly learning as well how we can continue to improve on that. But we don't specifically have a mental health project. Now, I'd also like to acknowledge Dr. Martha Condemo. Dr. Martha, you were here in Australia with us as a Rotary scholar. And Mart is with the Church of Christ in Congo and heads up care of the women within that church network, which I believe the flock you sort of look after is up to about 15 million. So Mart, welcome. And if you are able to unmute yourself, perhaps I can ask you, Mart, how do you feel women are being impacted by this conflict in Goma? And everyone is being impacted, but even on the photograph of the flyer that we had for this, that heartbreaking picture of the mother trying to escape whilst breastfeeding a child and carrying her load and carrying another child made me think I will never complain ever again of anything to do with motherhood here in Australia. So tell us, Mart, how are things affecting women?
Hello, everyone. Thank you. Yeah, the situation, I think, is really worse. And you could see me sometimes switching off my camera on and off because I'm in touch with the women leader of the ECC Church in North Kivu. So we are trying to see what we can do because our orphanage is full. Many people, since they were chased from the camp, so they have to find other refuge. And we are trying to organize how we are going to try maybe to give them some food or some clothes. So we are trying to work closely with them, and every day we just receive call of crying, of not knowing what future is left to them, and the situation is really not good. And when they go to bed, they don't know what might happen tomorrow. And many children have lost their parents. Some are in the hospitals, and many people also die. They don't know how to organize their burial because they don't have money. I also saw someone put it in the comment like the bank are closed, and those people are waiting for the government because the government cannot send money there, so most of them are not paid. So the situation is very worse, and as you know, women are the barrier for all this, and they are the ones who have to look for food, who have to provide, and the situation is not so. We are bearing with them, we are trying to see, and every day in my office I have to send something, even from my own pocket. They will call you, Mama, this is mission. Mama, we need water. Mama, we need this. And even yesterday I was talking with the president that I don't have anything anymore from my department, so if you can see what to do to try to help the children. The situation is still critical, and now with Bukavu in the same situation, because in the beginning we were focusing more on Goma, and now in Bukavu it's also the same situation, so we are very much God will help us. And with the situation with the VCC and the Catholic Church, what they are doing to try to bring peace in the Great Land, they are trying to manage. Yesterday, our president returned from a trip of 2 weeks where they went to Rwanda. They were in Goma trying to talk with the rebels. They went to Kenya, and he told us that he just came for 2 weeks. They're also going to go to Angola, and they're trying to negotiate so that we can find a peaceful solution for the DRC. Not a peace that will bring war again, but a peace that will be for a long term.
Thank you, Mart. Thank you. You're a little bit difficult to hear, but I think I got the sentiment of what you were saying. So thank you very much for being with us here and for doing what you do, and in particular efforts towards the orphans that have been created through this conflict. Thank you. And I have a question from Emil. And for both Dr. Wetzig and Ambassador Neuhaus, I'm keen to hear if there is anything that peacemakers could be exploring or doing even here in Australia to call for peace and to bring end to the suffering of the Congolese people.
Matthew, do you want to go first, and then I'll answer?
Well, I know Emil is an expert in peacemaking, so good to have him on this particular webinar. And my short answer is yes. And I think, having seen the example of organizations I've been involved with, the Great Lakes Association for Progress and Development, for example, which brings together people from the Congo, from Burundi, from Rwanda, from Uganda, in Australia, I do think that the diaspora can have a very positive role to play through their various influence that they can have on the actors back in this part of the world. And also because the diaspora are the ones who are actually providing a lot of support and assistance to their families back in this part of the world. So I think they should become active on it. And they should, use their contacts to encourage it, to show that there is a better way to work together. Because at the end of the day, there is going to have to, all these forces, including some of the M23, are going to have to work together in a much more positive way for the future development of this part of the world and for a sustained peace.
Thank you.
And I would reiterate that I think the diaspora has a wonderful opportunity to do a couple of things, to work across the ethnic boundaries. And as you heard from Matthew, and I meant to say, it was a wonderful assessment of the situation. But there is a great deal of distrust between Rwanda and DRC, and there are problems on both sides. But the diaspora can work together in Australia to have a positive influence and then influence our own government. The other thing I would suggest is that you feel somewhat helpless in this part of the world. What you can do is contact your local federal member of parliament or the foreign minister. And in fact, I have sent various emails to my foreign minister and also to members of parliament, asking them to actually investigate the situation and stand up against the human rights violations. Now, Australia is a small player, but we have contacts with the other major players like the UK, Europe, and the US. And I think we can play an influence in doing that. Penny Wong did tweet about 10 days ago about the situation, and that was helpful. The other thing I'm personally doing, which you cannot all do, is I'm keeping the Australian Embassy to Congo appraised of some of the human rights violations that we are hearing about, so that from people like Dr. Muller, from reliable sources, so that they are appraised and they then pass it on to their appropriate bodies, and that goes through Five Eyes and various things like that. So I think there are many things you can do to advocate. The final thing I would say is that there is a great need at the moment for funding for medical equipment, for food, and for a whole range of activities. And that's something people can do to contribute to that. As I felt for Ellie, who I do not know Ellie, but I saw in the chat he had put in the chat something about how desperate the situation is in Goma, and he's just reflecting everything I am hearing. The banks are still closed. People cannot get money. I know that Heal Africa, for example, is working through a Gisenyi Rwandan branch of the Bank of Kigali. So money can be transferred through to them. And we have been doing that from our charity, OzHeal, to provide fuel and things for the generator to keep all the equipment in the hospital going. But there are many things like that. Food is a great need. But I think advocacy to your local member of parliament, advocacy to people like the UN and the World Food Programme, and advocacy within the diaspora and mutual respect within the diaspora is also important.
Thank you so much. We're rapidly coming to the end of our hour together, but I just want to acknowledge one comment from Rogers Mbanza, who says, I am originally from Goma, but have been in Australia for the last 18 years and I live in Canberra. I just hope that your family, if you have any, in Goma are safe, and that you have support as well here in Australia, because there are many people who do care about what is happening in Goma. So finally, Ambassador Neuhaus, 30-second closing comment from you.
Well, for such a complex situation, but thank you very much to Hand Up Congo for so successfully putting this out there. And I do encourage all of those involved to help publicize this issue and keep pressure on all sides for a peaceful resolution. That is the only way ahead.
Thank you. And Dr. Wetzig, final comments from you?
I would just reiterate what Matthew has just said, but please keep the people of Congo, in Eastern Congo, particularly North and South Kivu, in your thoughts and prayers. If you have any influence over press, that's another issue you can do, is draw it to the attention of the press. I wrote an op-ed for the Australian, didn't get published. It was basically trying to highlight the situation. And I think that what we can do is provide advocacy and support. They're the key things. It's a complex situation, but I just finish with an African proverb that says, when elephants fight, it is the grass that suffers. We may, want to take sides between M23, Rwanda, Congo, etc. but it's the people on the ground that suffer. It's particularly the women and children that suffer. So please just remember that when elephants fight, it's the grass that suffers.
Thank
Vera,
you.
Vera, can I
Yes.
just quickly say
Yes.
that ABC Radio did speak to me last week. I was able to speak on it. I was very delighted through Hand Up Congo to do that, making Neil's point about the press. At that point, I was particularly critical of the UN Security Council, and I'm pleased to say that there was action a few days later in the UN Security Council. So keeping up this publicity, I think, can help, and I encourage that. But I look forward to seeing your op-ed perhaps somewhere else, Neil, if the Australians didn't do it.
Yes, thank you so much. And I'll just, in case Dr. Muller is there, Dr. Muller, if you are on, just unmute yourself. And if you're not, you have our deep appreciation. All right. So it remains for me to thank all of our speakers and technical team for this stimulating session, which I have thoroughly enjoyed, and I hope you have too. So please join me in a round of applause, and you can sign applause like this if you're on mute. So thank you. And of course, merci mingi, thank you to all of you for participating. As some of you may know, February has been designated Peace and Conflict Resolution Month by Rotary International. Hand Up Congo works closely with Rotary to facilitate peace building, donations, and information about the DRC. We will continue to post updates on our Facebook page. If any of you would like to know more about possible donation pathways to assist with the humanitarian aid, or if you have any questions or suggestions for future virtual meetups, please email Lucy on handupcongo@gmail.com. This brings our virtual meetup to a close. Thank you all again, and au revoir.
Bye-bye.
Au revoir.
Bye.
Merci beaucoup.
Au revoir.
Au revoir. Merci beaucoup.
Typical.
Merci beaucoup. Merci
Bye
beaucoup.
bye.
Bye
Bye
bye.
bye.
Bye bye. Bye bye.
Bye bye.
Bye bye. Bye bye. Bye bye.
Bye.
C'est gentil.
Au revoir. Tout.
Au revoir.
Au revoir. Merci, Romain.